feel that tingling in the back of your shoulder there by now? Or
Back of my shoulder? Maybe a little bit.
A little bit now? Oh, there we go. Okay. We'll push it all out. Good. That's a good one. And I know that this is tender. Don't be afraid to make funny faces for the thumbnail.
It's already happening, whether or not I want to.
Good job. Hey guys, thanks for watching the channel. Appreciate you tuning in today. I noticed that not all of you are subscribed who watch my channel. Looks like 80% of you aren't, and I still appreciate you checking in, but if you could take 10 seconds and hit that subscribe button, it actually really helps me pay rent. So thank you so much. Appreciate your time. Have a great day. Steph, good to see you today. Thanks for agreeing to come in. So Steph is a personal trainer at the gym that I work out of, Primal Athletics in Oakville. She's in today. You haven't seen you've seen a chiro, but you haven't been treated by one before, right? What does that mean again? I don't actually know what that means.
I think when you told me, like, have you seen a chiro, I was thinking about, like, watching, like, videos, because you mentioned the video, but no, I've never been
she's seen them, but she hasn't been treated by one before. And she's in today to, well, get treated by one, right? So I'm going to let her kind of talk about what brings her in. She said she has some rotator cuff stuff, some back stuff. Do you mind walking us through kind of the shoulder injury to begin with?
Yeah, so I was a swimmer for like 12 years, and so I just had like issues with my shoulder for the longest time, and then I think maybe a year and a half ago or something, I went to a physio, and he didn't really do any tests or stuff or anything like that, but he told me that I had like microtears in my supraspinatus and bicep tendon. And then I stopped going.
So what, if I can ask, like, why did you stop going to them? Was it ineffective, or you just didn't have the time, or what was the rationale?
A little bit of both. Like, I wasn't doing any of the exercises on my own, to be honest.
At least she's honest. We appreciate honesty and patience.
Yeah, so it's just like there wasn't any point in like spending the money to go to a physio, and he didn't do any imaging or anything like that. So I also felt like he just like maybe didn't get a full picture of what was going on.
All right, that's funny. Imaging picture. Did you do it on purpose? That's like a little bit of a pun, but anyways. Okay, so that was a year and a half ago. Are you still swimming now or no?
No. Like casually, if anything, but usually like my shoulder starts hurting quite a bit. So
okay, yeah. So just FYI, I don't know. I can't remember if we've talked about this or not. But I used to be a swimmer too. Okay, and I actually mucked up both my shoulders. One with a supraspinatus, one with a bicep tendon. So that sucked. Yeah, that was awful. I went to physio like one time. Physio didn't know what was going on. Neither did the chiros I went to go see. So it was 15-year-old Adam Googling his shit, trying to figure out exactly what was going on and then rehabbing it. So that's something that we'll probably be able to talk about today. Imaging. It's kind of hit or miss for a rotator cuff tear. It's not always necessary if that's even what's going on. But we'll do some tests today. We'll confirm or deny what the physio said and figure out what to do from there. Okay, sorry guys, I think we got some background noise in the lobby, but we can ignore that. Tell us about kind of the neck and the back stuff as well, if there is any.
Neck, probably just stiffness every once in a while. My back just will hurt.
It'll just hurt, right? All the time?
I mean, not all the time. That's probably not accurate, but like...
a lot of people have backs that hurt all the time, unfortunately. Yeah. You're still like... How old are you?
I'm 22.
You're 22, okay. So like, give it another 3 years and it probably will be all the time. No disrespect.
Well, I mean, that's why I'm like specifying, not all the time just yet, but... just randomly I feel like my back starts to hurt.
Okay, fair. Neck and the shoulder, very intimately connected. If your shoulder is not functioning correctly, your neck's going to pick up a lot of the slack, so is your upper back. Lower back, that could just be its own thing, but we'll take a look at it right now, see if there's anything going on anyways. Is there anything else at all, or is that pretty much summarizes what's going on with you, what you want to get looked at today? Pretty much it? Awesome. Okay, so what we're going to do then is that we're going to get into the physical exam, and then we're going to find out what would be best to treat you. Okay?
Cool.
Awesome. All right, so first off, Steph, which shoulder ended up getting kind of busted for you, left or right, or both?
Definitely both.
Definitely both?
Yeah.
Okay, was there like a supraspinatus on one and a biceps on the other like me? Is that what the physio suggested?
I think he said both of them would have been on my right, but my left there's a lot of weakness and there's still pain.
Left there's a lot of weakness and there's still pain there. What kind of activities aggravate the shoulder pain for you right now? Obviously swimming's one, but what else?
Like any sort of workout that does involve the shoulders, like doing push-ups, like if I do several push-ups,
really,
I'll like yeah, it'll.
Okay, even if you bring the elbows kind of tucked in, make it more constant bias, that's still bothering your shoulder. Right?
It probably actually bothers me more if I have my elbows in.
Okay, all right. Let's start with the shoulder examination then. So first things first, we'll start with your right side just because it's the side I'm on. I need you to give me a thumbs up, please, and keep it right there. Don't let me move your shoulder, okay? Does that cause any discomfort for you at all? No? Okay, give me a thumbs down, please. Keep it there. Better, worse, or the same?
The same.
The same, okay. Relax for me. Any discomfort with that one?
Probably right there.
Right thereabouts as we start to get really high? Okay, so that's a positive nears test. We're going to bend the elbow and we're going to rotate in like, oh, that's bad too there. There's a Hawkins-Kennedy. Okay, so coming back here, keep your arm here. Don't let me move it, okay? Fight me, fight me, fight me. That okay?
Yeah.
Good. Push, push, push. Fight me, fight me, fight me. That okay too?
Yeah.
Yep.
It's okay, but it's like tough. Like it feels
it's a tricky one for you. Yeah. Okay, put your hand behind your back. And I want you to try to lift your hand off your back to touch the wall back here. That's a little tricky for you, huh?
Yeah, like it's hard.
Okay, do you get discomfort or it's just an unfamiliar movement for you?
I think it's more so when I come out of each movement that I start to feel it, but when I'm in it, I'm okay.
Okay. So you can take this, you can fix this arm here. So one thing that I'm noticing immediately is that the nearest test bringing up is, sorry, I just covered your face there, as well as the Hawkins-Kennedy. Those are two tests to check for what we refer to as impingement syndrome on the supraspinatus muscle. We'll bring up a diagram of it there, so Sarah include that there. As well, when we're doing the resisted external rotation of the shoulder, which relies on our infraspinatus rotator cuff muscle, the infraspinatus is one of the primary stabilizers as compared to the other rotator cuff muscles. So it's my belief that if we're able to strengthen that infraspinatus a bit, it'll help to keep the humeral head back further, prevent some of that impingement on the supraspinatus. That's some complicated ass anatomy that the average person won't be able to figure out, but that is what I've seen in practice before. I can walk you through this in more detail using my app afterwards if you're interested. Did the physio ever kind of give you that rationale or no?
No.
No? Okay, well that's bad news to hear, but good news is you're in here today. So let's check out this shoulder. Same deal, thumb up, keep it there. Better, worse, the same. Alright, sorry, anything at all with this? We haven't done anything on the side yet.
It's okay.
It's okay?
Yeah.
Alright, give me a thumbs down, please. Is that okay?
It's harder.
It's harder. Okay,
Yeah.
so is it harder because of pain or it just feels weaker?
Feels weaker.
Feels weaker. Okay, so once again, stand like this. That's okay?
Oh yeah, that's fine.
Okay. Come here and rotate inward. That's okay compared to the other side?
Yeah.
Yep, okay. Keep your arm here. Fight me, fight me, fight me. That's fine? Good, and fight me, fight me, fight me. That's fine? Okay, so no pain on this side, or no weakness rather as compared to this side? Or do they both feel kind of weak?
This one feels weaker, but not as much pain.
Not as much pain, okay.
Yeah.
Put the hand behind your back, and then lift up, try to touch the wall. Still another unfamiliar movement for you, but that doesn't cause any discomfort either, other than just being unfamiliar.
Yeah.
Perfect. Okay. So it's possible if they were getting weakness on both sides of the infraspinatus, we're gonna want to work both sides, obviously. But the supraspinatus may be more intact on this side as compared to this side. That's why we can experience the same level of weakness on both, but we're getting pain on this side. If you were to maintain activity, the swimming that you were doing that aggravated the shoulder, likely this one would have gone as well. That I believe the physio did say as well. So one thing we're going to try to do is really focus on strengthening those infraspinates with external rotation movements. Do you do, as far as you know, any kind of exercises, external rotation of the shoulder?
I do.
Yeah. Okay. So that's something we're going to want to talk about probably, well, we'll go to the gym after this. Unfortunately, I can't bring the camera into the gym, lighting shit. Excuse my language, but we'll talk about that. Okay? Next up, let's check the neck range of motion. You can get your face forward. Rotate your head as far as you can to the right for me, please. We can get to about 55 degrees. Rotate as far as you can to the left, please. Get to about 55 degrees. So that's equal bilaterally. We like that. Bring your chin down to your chest for me. Does that provoke any kind of stiffness or tightness back here at all?
Not really.
No? Okay, now what if I push the head? Better, worse, or the same?
Definitely more.
Definitely more, like, but is it like to the, oh, are you feeling it down here?
Yeah.
Yeah, okay. I saw her reaching for like the middle back, and that's very common. Remember, our traps go from the top of the head out to the shoulders and then down into the middle of our thoracic spine there. So it's very common that when we flex here, we can feel pulling all the way down here if we do have chronic tightness. So I'll get your face forward. I'll get you to bring your chin up and back, look towards the ceiling. Does that cause any discomfort in the neck at all?
No.
No? Now if I do something mean, still okay?
Yeah.
Awesome, good. Tilt right ear to right shoulder. And we get to about 45, left to left. We get to about 45. Okay, so we've got some tightness of the traps, but overall the range of motion of the neck is equal bilaterally. We might be a little bit reduced in rotation on both sides, but at least we're symmetrical. So good job on being consistent.
Thank you.
Actually, no, we gotta do range of motion here too. So I'll get you to give yourself a tight hug. Tight hug, you probably earned it. Rotate as far as you can to the left. Here, you got the bushy hair, I gotta move that.
Sorry.
It's okay, we got 45 degrees and to the right. We got further, when we go this direction, we got about 60 degrees. So we do have some restrictions rotating to the left as compared to the right. Drop those arms. Stand up for me if you please. Could you please bend down, touch your toes? Does that cause any discomfort in your low back at all?
No.
No? Alright, and then get you to come back the other way and I want you to extend backwards for me. Any discomfort in the low back at all with that? You're going farther than I was anticipating. No, that's okay too? Awesome. Alright, so bring both arms up for me, keep them there, okay? Is that okay for you? Yeah, that seems okay. It's probably a little bit painful, but alright. And I'll get you to do that. Good. So this is a neuromotor testing strength. You can relax those arms now. With patients who do have supraspinatus issues, they can get a false positive neurologically keeping the shoulders up like that because the supraspinatus abducts the shoulder or brings it up. But it's not neurological weakness, it's just the muscle itself. So it's not a positive neuro finding, even though she managed to keep it up. But so you guys know, if any clinicians are watching. Arms forward, curl the wrists backward, please. I'll get you to actually bring them up a little bit higher just so the camera can see. Curl the wrists backward. Perfect. Fight. Fight. Nice. Turn over, curl the wrists in, nice nails, fight, fight, fingers curled, strong, strong, strong. Stronger, there you go. Turn over, fingers straight, please gently squeeze my fingers. I have to stay gentle because somebody nearly broke them once upon a time. You did not. All right, I'll get you to relax your arms there, good stuff. And turn this over, keep right there, and relax as best you can. There we go, there's a little twitch. There we go, there's another twitch. Drop the arm for me, give me the full weight of it. There we go, awesome. So that worked. Same deal on this side now. It's kind of tricky to do from this angle, but good. Good. And drop the arm for me, drop. There we go, good. Normal upper limb neuro exam. Lastly, let's check the biceps tendon. I want you to go ahead and give me like a curl position, okay? And now I want you to curl your wrist into my hand. Does that provoke the pain in the shoulder or not particularly?
No.
Not particularly? Okay, same deal on this side, why not? Does this provoke the pain in the shoulder or not particularly? No? Okay. So there might be biceps tendon involvement. Maybe it's healed up, but that test provoking or activating the biceps and then prodding at the tendon, negative, so that's not really my impression of it, okay? All right, Steph, push this leg up into my hand as hard as you can. Push this leg up as hard as you can. Lift this toe up as hard as you can. Lift this toe up as hard as you can. Good. Let me position your ankle here. I want you to try to push your ankle that way for me, okay? Go ahead. Good. And same deal, pull your ankle this way. Good. Awesome. Okay. Relax both legs as much as you can. Okay, actually scooch back so your feet are off the floor, please. There we go. Good. And relax both legs. We actually need to... It's really hard to do this backhand. There we go. Small kicks. Relax the foot. Good. Relax the foot. Good. And people hate this one. Yeah. Okay, good.
That was awful.
Yeah. That's called Babinski's. It's a real thing. It's actually the one that checks for the important stuff. I mean, it's all important, but the really important stuff. And you're negative, which is a good thing. We like being negative on this kind of stuff. But normal lower limb neuro, we have perhaps reduced reflexes on the L5 quadriceps reflex or the patellar reflex as compared to the upper limb. Steph, my hands are going to go on your back now, okay?
Okay.
So I know that Steph's primary complaint is obviously those shoulders, and we will talk about that in a bit. But what I'm concerned about is what her body has been doing to compensate for those shoulder irregularities. Now, she's a very active individual, okay? She's a personal trainer. She probably works out in her free time, I imagine. So that's something that, of course, if the shoulders aren't up to scruff, well, then the neck and the upper back absorbs that through irregular movement patterns. So I want to feel through and see if we have some kind of weird levels of tension, which as we go higher and higher, I definitely feel like we do more so on the right side than the left. And it's the right shoulder that's worse than the left. Yes, I remember my short-term memory loss is kicking in here.
Yes.
But yes, okay, yeah, good. That is the one that we were just working on. Perfect. Okay. Okay, and we say we do have occasional low back pains too. So let's go ahead. The SI joint is at the bottom of the spine, the sacrum connecting into the hip, right about there. So compressing there, pressing there. The right side feels locked up, but are you getting any discomforts at all with this, or does it just kind of feel like I'm pressing on you?
Just feels like you're pressing.
Pressing, okay, good. Lucky Steph. The right side, though, to my hands, feels like it could use some work, so that's something we'll do in a bit. Now, you've never seen a chiro, well, you've seen a chiro, but you've never been treated by a chiro or been adjusted before then, eh?
No.
That's exciting. Okay. So the first time that you adjust anybody, so what I'm going to do is I'm going to try to release some of your upper back here. Okay. The first time that you adjust somebody, there's actually no way to know how much force is needed. Okay, so therefore I always start lighter, and if things don't go, I gradually add a little bit more, a little bit more, a little bit more. But we're going to start light, obviously, today. Now, what I need from you, in order to make this work, is I need you, A, to just be as loosey-goosey as you can. Loosey-goosey. And B, to just take a big breath in for me. And then all the way out, all the way out. Push it all out. Good. How was that? You okay?
Yeah.
She's still breathing, guys. That's good. Okay, there's one here. I'm just going to turn your head, okay?
Mm-hmm.
That one was a little bit more subtle, but that's okay. Breath in. All the way out. There's a good one there. And if I go here, I'm not moving the camera, am I? No, perfect. Breath in. All the way out. That was another subtle one. You're actually in a pretty good position here. I'm going to get you to bring this leg up just like that and scooch the hips closer to the edge here for me. Thank you. All right, so this hand is going to go on this elbow. And I want you to take a big breath in for me. All the way out. Good. Whew.
That was a lot.
There was a lot there.
That's crazy.
Damn. All right, we'll get you on the other side, see if it matches. Right, I'm going to take this right there. Hips a little bit closer. Thank you. Don't even need a breath in or a breath out.
I'll take it. I
You
guess.
okay?
Yeah.
Awesome. So once again, like I was saying, the shoulder and the upper back and the neck are all very connected. If this is having issues, that means that this and this are going to have to overcompensate. We've already done the upper back. All right, that went really, really well. So now we look into the neck, and then we're going to look into the shoulder itself proper, probably with some dry needling. So we're going to get an acupuncture video, guys. We don't get those very often. So, so what we're going to do here is, do you get headaches at all or not particularly?
Yeah.
Yeah?
A little bit more recently.
Okay, is that, do you think that's like distress, or can you point to any causative factor, or no, you're not sure?
I don't know,
Okay.
yeah.
Well, let's go through and feel through the neck. So first thing we're going to do is start at the very top and work our way down. Okay, so we're already kind of wincing there. So what I'm feeling is right at the very top of the right side actually is quite a deal of tension, especially when we compare it to the left. Like, it's a lot less present on the left. It's there, but not as much. So again, when we do have suboccipital, that's that muscle group, hypertonicity, also known as tightness, that can cause headaches. I'm not saying that's what's causing them, but I am saying that it's present and our headaches are more frequent. So it's worthwhile at least getting rid of that tension and then investigating if that improves the headaches at all. So we might help your headaches today, is what I'm trying to say. Okay, no problem. So let's start with some MRT, taking that contact. And I know that this is tender. Don't be afraid to make funny faces for the thumbnail.
It's already happening whether or not I want to.
Oh, man. All right, now as we get lower down to the right side, I'm noticing some lockup too. Again, is it due to the shoulder? Likely, doesn't matter. We're going to try to free it up today. So, you've never had, that was my elbow, by the way, guys. You probably heard that on the microphone. Oh, that was awesome. Okay. Now, you've never had your neck adjusted before, have you? Are you nervous at all about it?
Yes.
You can be on. You're nervous about it, okay. What makes you nervous about it? You can be honest.
I don't know, I've always I guess wanting to crack my neck, like there's like I get enough attention that I feel like I could just.
Yeah.
But I can't do it. So.
Oh, you can't do it yourself.
No.
Right. Okay. So the reason you're not able to do it yourself is because it's really hard to apply the necessary force. Because when you move your neck, you need to do it by tensing up your muscles, okay, and by using them. If you're having somebody else do it, an external factor, me, you don't need to tense up your muscles at all. Therefore, it's much easier to get through down to the joint structures, which are where we get the cracking or the popping from, right? Or the cavitation, that's the actual term for it. So to do it, though, I do need two things from you. Okay, the first thing is for you to turn your head. I'm going to start with your right side. Okay, the first thing is for you to turn your head as far as you can to the left. All right, and then relax it in my hands there. Good. Now, the second thing that I need from you to make this work
oh my goodness.
is to not know that I'm about to do it. So, how is that? You still with me?
Yep.
Good job. Oh my goodness. Okay, so bad news is that trick actually only works one time. Yeah, but you actually were very, very relaxed. So I'm very impressed with you, Steph. Good job.
Thank you.
That was a really good one.
Yeah, it was. It feels good.
That's a great. I'm glad it does. That's the point of this. That was a great first recorded neck adjustment. I haven't done these in about a month. And let's check out the left side. Okay, turn as far as you can to the right, please. Good, and just relax that head. Good job. Well, congratulations. You tried something new today. Something that probably scared you. I think you're supposed to do one thing a day that scares you. I think somebody famous said that once upon a time. Does that quote familiar to you?
Yeah, for sure.
Do one thing a day that scares you? Yeah, you're just saying that to be polite. I appreciate that a lot. All right, let's get into the shoulder itself. All right, so one method of treatment that's been found to be quite effective at helping to restore shoulder range of motion and decrease shoulder pain is dry needling, which is essentially the medical equivalent of acupuncture versus TCM practitioners or traditional Chinese medicine. So just going to throw some sanitizer on it because it's important that we sanitize. Fun fact about this, though, there's actually no statistical rate of difference in inserting the needle before or with sanitization versus not sanitizing. You can look that up, but all the same, we're going to be abundantly careful here, plus, optics. So I'm going to go ahead, put that on, and then dry it off. Okay. So what we're going to be doing today is dry needling and probably also hooking up to a small electrical current and running it through those metal needles. And the idea there, if you've ever used a TENS unit before, which a lot of physios are fans of, is to run that electrical pulse through to help decrease pain and also stimulate a little bit of what we refer to as the opioid-like theory. Now, when people hear the term opioids, they usually freak out, and rightfully so. Why? Because they look to the South, the States, and there was the whole opioid epidemic there. It's still ongoing. It is getting better, but it's ongoing. We naturally secrete opioid-like compounds, okay, which are natural painkillers. One of the mechanisms that we do this is by exercise or engaging a muscle, relaxing a muscle, engaging a muscle, relaxing a muscle. Fortunately, you are able to exercise, but in people who aren't, this is especially effective because we get that muscle to contract, relax, which then still stimulates the secretion of the opioid-like compounds, helps to decrease pain further. Anyways, you need to bring this arm up for me. Look right there and there. Good. Now you can bring it back down, please. Ooh, that was a little shaky. You okay?
Yeah.
Yeah. You cold? No?
No,
Okay.
I'm nervous.
You're nervous?
Yeah.
Well, didn't you say you've had dry needling done before?
Yeah.
Okay, then what could you possibly be nervous about?
It wasn't, it was fine, but it was there were some spots that were just really,
Really quite bruised?
Yeah.
Okay. So the bruising can be normal in some cases and is usually most prevalent when I got my elbow in the way of this, is usually most present when we accidentally nick a branch of an artery or a vein or something, okay? But I reassure you, it doesn't always happen. So I have a good feeling that you will be okay today.
I mean, the bruising's okay, but it's the feeling when you're dry needling. It's
Oh,
not
so
my favorite feeling in the world.
Okay, well, when you say dry needling, do you mean on insertion or flicking the needles around? Because some people will flick them around.
Flicking the needles.
Okay, well, I'm not going to flick it around today for you then. Okay?
Oh,
I'm going to
okay.
hook you up to the current and let you be.
Cool.
I know. Everybody on the internet thinks so, but nobody in my house does. All right, good. So usually around this time, I also like to ask patients a question about themselves, just to let the audience kind of connect with them a little bit more. Usually we do that with the sports massage. I don't think we're going to be doing the sports massage today. Sorry, guys. But my question for you, Steph, is to tell us about something about yourself for which you are proud of, but don't get to speak about very often because it sounds like you would be bragging. I know,
Okay.
bit of a question.
Something that I'm proud of. Okay, I guess this is like work related.
Sure.
But it makes me happy, so I'll
Oh,
talk
good.
about it.
And it makes us happy too.
I like, so as a personal trainer, like I mostly have been doing group classes, not really like one-on-one training.
Okay.
And I've been doing it for a year and a half now.
Sure.
And a lot of the time you feel like you're kind of just doing the same thing day in, day out, and you're not really like making much of a difference, I think.
Okay.
Sometimes just because people like, you know, it's their daily routine. They come in to do their workout and like they'll be like, oh, thanks for the workout, and they'll leave, but they don't necessarily like, they're not like super stoked to have come in just because, you know,
It's a boot
everybody's
camp. Even if you like them, you don't like them.
Exactly.
Yeah, like that's the thing. Yeah.
And it's just like, you know, like it's just a regular part of your day. Like you're not gonna walk in and be like, I'm super stoked to like do this super intense workout after a long
Yes.
day. Like it's just not gonna happen. But when I was leaving to come, so I study in Vancouver and I came here for the summer.
We're in Ontario, guys. Yeah.
Yeah. When I left Vancouver, I like was talking to my clients, and it was like my last couple of days, and they were all like, oh, like, we're so sad that you're leaving. Like, it's been so good having you here. Like, you're such a big part of our daily routine, even though we don't talk about it. Like,
Aww.
we're gonna miss you. Like, it's hard to say goodbye. Like, we don't want to have to not have you be a part of our daily routine, even though we don't show that appreciation.
Sorry, Steph. I'm just gonna ask you real quick. Do you feel that tingling in the back of your shoulder there by now, or not yet?
Back of my shoulder, maybe a little bit.
A little bit
Starting
now.
to
Oh,
get
there we go.
low.
Okay, so what we see there is a contraction of the shoulder. That's from the electricity itself. Is that intolerable, or is that okay?
It's okay.
It's okay? All right, now we're going to do that for the top of the shoulder as well. Sorry to cut you off. I just want to make sure that I don't put this too high for obvious reasons. So that's what we get when we do pass an electrical current through a muscle, by the way. Okay, usually the electricity is supplied by our brain and our nervous system. In this case, it's supplied by a small battery. Now again, I can look at the front from the camera here. But so yeah, no, anytime you're doing work and you kind of fall into the monotony of it, it can be very easy to think what you're doing isn't making a difference. Take it from the guy who sees, 20 patients a day, and many of those patients, the treatments looks very, very similar. But you are making a difference, Steph. Okay, like don't think that you're not, all right? Because those people, if you weren't around, where would they get their exercise from, right? Okay, looks like the back's come down a bit. There we go. Is the front twitching there? Can you see it, Steph?
I'm looking at it, but I'm just, oh, there we go.
There we go.
Yep.
Perfect. Okay, and now we camp out for about 10 minutes. Sorry, continue with what you were saying.
Yeah, that was pretty much it. That's what I'm proud of.
Good. Well, thank you for making a difference and helping to promote fitness to the greater community. Seriously, that's something that we are all more in need of, more than ever, for now. So what we're going to do at this point, okay, is that we're just going to kind of camp out with the needles in for about 10 minutes. I'm going to fast forward this probably at times 20 speed, so feel free to talk whatever you want because it's going to be muted as well. People can't hear all the unprofessional, non-professional speak. First thing I'm going to do is, turn off the current so I don't electrocute myself.
It's a good plan.
Thank you. I like to think that most of my plans are at least possible. I'm going to go ahead and take this off. Good. 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 Good.
Woo.
Alright, sit tight for a second and we'll remove. Now, forewarning, anytime we remove needles, there's always a chance of a small bleed. So let's see what we got.
It's okay, bruising doesn't bother me very much. It's just the feeling.
Here. Last one. You are no longer a porcupine.
Nice.
There you go. Good news. No bleeds. We're good. Steph.
Hey.
We're finished the manual therapy component of treatment today. We're going to get into the gym after this to go through the rehab stuff. But first, I kind of want to know what your impressions were regarding the treatments today. Obviously, the dry needling, like you got the mixed feelings on that previously, but how was the adjusting? Because that's the first time I've ever had that done. So what was that like for you?
Upper back was, I feel like pretty much what I was expecting. I feel like I've had my, like, even though I've never gone to a chiropractor to get it adjusted, like, I always get people to crack my
Yeah,
back,
I hear that a lot. Yeah.
Yeah, so I don't know if that's good, but it felt pretty much the same.
Some people will say that that's dangerous. I'll say it is, but not as much as you think it is, just because the people who are adjusting that aren't chiros, not trained in it, use a lot of mass rather than velocity. Force equals mass times velocity. You're more likely to get hurt with higher mass than you are higher velocity in this case. So that's why it's ever so slightly safer to have somebody who's trained into it, but I don't think you're going to break anything, again, especially because you're young and you're fit, right? But how is the neck, though? That's definitely something you've never had somebody do before.
Yeah. It was actually better than I expected. I think that you caught me off guard. That was a good thing.
Yeah.
Because I was stressing a little bit. But it feels good. Yeah, it felt good.
I'm glad you think so. This is the only time that I will ever advocate tricking your patients. Okay? Otherwise, that's a hard no. You never want to do that. Okay? Unethical. But that's the only time I'll ever advocate it. Okay, good. I'm glad overall positive impressions. Before we get into the gym, do you have any questions, comments, concerns, anything else that you want to talk about for now? Or you think you're okay? All right. Well, thank you so much for coming in today. Really appreciate your time. Let's get going for it.
Don't forget to like, comment, share, and subscribe.
Thank you so much, Steph.